So the thing that I liked about this situation is that sometimes it seems a little formal to have him introduce himself when many of the patients know him. But the thing that it accomplishes is it really kind of reminds them of the expectations, because they get used to him sort of being really familiar to them and their friend, and then forget that he really is in this professional role where he has to interpret everything. And he's just reminding them, as close as we seem to be, etc., I'm going to interpret everything in here just so they know what the game is. So I'm just wondering for you, Tony, how weird does that feel to have to introduce yourself to somebody you know, or can you do that easily?
I can do it easily, but it's just that it's unfamiliar to the patient, where they know me already, that I have to reintroduce myself to them.
As a patient, does that seem odd to you that you're going to have somebody introduce themselves if they're the interpreter, or does that seem?
Yeah, but English, okay?
Yeah.
I prefer that it kind of has to be formal, like even I know him, but I prefer he say, hey, my name is Tony. I want it. To remind him. But sometimes patients they kind of they don't care. They don't care. They say, Tony, can you help me? But whatever I told you earlier, just tell him, so I don't need to repeat it.
Right.
Yeah.
And then we have to stop and say, listen, I can get a little bit of backstory here, but I have to confirm it because I can't necessarily take Tony's interpretation for it. So then he has to repeat himself, which is awkward sometimes.